Hi there, my name is Riley Johnson, and I will be presenting over the crisis condition of the Zika virus. So an overview of what we will be talking about today and what the audience should be able to do based on the objectives are to identify the causes, symptoms, and the general location of the Zika virus outbreaks that have occurred. Understand the effects of the Zika virus on vulnerable populations, and identify the local, national, and global responses to the Zika virus outbreaks. So what is the Zika virus? It is a mosquito-borne virus that was first found actually in monkeys in 1947. And then the first case of the Zika virus for humans was found in 1952 in Tanzania. Some symptoms that one person may have when they are infected with the Zika virus are common general illness symptoms for viruses, which include fever, rash, headache, joint pain, red eyes, and muscle pain. The majority of adults actually may not develop any symptoms at all. They may just think they have a slight cough or just general feeling of unwell, but it may go away within a very short time. And usually it's not as severe if they do develop symptoms. For example, they will not need necessarily to go to the hospital, or there are not very many high death rates in adults from this virus. It is transmitted through mosquito bites. If a mosquito bites someone who's infected and then bites somebody who is not infected, that transmission of the Zika virus is given to that second bit person. Also through contaminated blood or blood products or organs. So for example, a contaminated blood transfusion or an contaminated organ transplantation. Also from mothers to their fetus. If they have an infection, it does cross over the placenta, and then through sexual contact through fluids in that way. There is currently no vaccination or medication that can be given for prevention of this illness. I will get into this a little bit later as a focus on vulnerable populations for the Zika virus, but three of the most vulnerable populations include women of childbearing age, pregnant women, and young children. And then some of the outbreaks that have occurred in 2016, which is actually when the World Health Organization declared that the Zika virus as a public health emergency in February of 2016. These areas include the North and South Americas, the Caribbean, Puerto Rico, and then some Asian countries. It's mainly focused in tropical and subtropical areas where those mosquitoes do thrive in those conditions, especially in areas where they do have water, because they need to lay their eggs near water so they can grow and become full adult mosquitoes. This is a good map that I found from the World Health Organization of countries that have documented Zika virus infections. So those yellow countries there, you can see those are the countries with a reported outbreak from 2015 onwards. So the North and South Americas, there are all those countries within there. There are several documented Zika virus infections there. All the way down to the tan, which is that lighter color brown there, countries with possible endemic transmissions or evidence of local mosquito-borne Zika infections in 2016 only, so when that large outbreak was going on. And then that dark brown, countries with evidence of local mosquito-borne Zika infections in or before 2015, but without documentations in cases of 2016 or an outbreak has terminated. So those yellow countries are really the ones where Zika virus is the potential to be spread quickly. So here we'll go through the population that's impacted. So everyone is impacted by this, but there, like we talked about earlier, are more vulnerable populations that can be involved and have further illnesses from this. So for many people, like I said, they may display mild symptoms and they may not get sick enough to die or go to the hospital, for example. But for the vulnerable populations of women of childbearing age, pregnant women, and young children, it can be harmful because Zika virus has been linked to causing microcephaly in a fetus, neurological disorders, and even a rare disease called Guillain-Barré syndrome. That picture there, that is a demonstration of microcephaly. Essentially, in utero, the brain does not grow as normal, and so the head is much smaller than it should be, and it also does not grow past birth. So this can cause several neurological disorders. The brain has not developed properly, and it's very detrimental and a chronic disorder that can come from infections of Zika virus. So it's very important for women of childbearing age, pregnant women, to not become infected and pass it on to their growing child and young children as well, because they are still growing and they grow rapidly. So a local response to the Zika virus within the countries that have the documented Zika infections, especially in the Americas. Locally, the CDC recommends that there was protecting yourself from the Zika virus infections, essentially. So the mosquitoes, they tend to bite during the day and at night, unfortunately. So to prevent being bit while sleeping, as you see that picture over there, this is a mosquito net. It essentially prevents the mosquitoes from landing on you and biting you while sleeping. Using insect repellent, wearing clothing over to cover all of your skin throughout the day, preventing unwanted pregnancies. This is important. So if you become infected with Zika and then having an unwanted pregnancy, that you don't have that risk of transferring the virus over to the unborn fetus. And then finally, sexual education. It's very important to know that you can still get Zika virus through sexual contact, not just the mosquitoes. And then vector control in your home or out just around your home. Utilize insecticides so that you can actually kill the adult mosquitoes who may be infected and transfer it to somebody else. And then remove standing water from around your home, because this is where mosquitoes like to lay their eggs. For a national response, again, one of the biggest ways that they can actually reduce the spread of infection is vector control, or control of the mosquitoes, essentially, to reduce or interrupt the transmission through mosquitoes. So governments utilizing larvicides, insecticides, and adulticides, utilizing aerial spraying and truck spraying throughout their nation. And several governments have created their own integrated mosquito management programs. This is so they can follow exactly along with what techniques they're using to reduce the mosquitoes. Removing standing water, like we talk about, neglected swimming pools, trash, discarded tires, and drainage ditches with standing water. And then, like I stated before, new public health programs have been created to focus solely on the Zika virus. Lastly, the global response, the Pan-American Health Organization and WHO implemented a Zika virus strategic response plan in each region to focus on assistance with prevention and control strategies. This essentially was very large in the Americas region because of that outbreak focused on right there. And then there was an international travel advisory issued to populations at risk and people traveling to countries with documented Zika virus cases. They utilized the slogan, "Know before you go," so that way you know what risk you have and what populations are at higher risk and what countries have documented Zika virus outbreaks, and at that moment in time, how many. Um, they stated that women of childbearing age and people with partners of childbearing age should follow those CDC guidelines about traveling to areas with Zika outbreaks. So in summary, the Zika virus is a mosquito-transmitted disease, mainly in the Americas regions. It causes microcephaly and neurological disorders in young children. Vector control reduces the spread greatly of the Zika virus locally, nationally, and internationally. And vulnerable populations include women of childbearing age, pregnant women, and young children. And here are the references that I utilized. If you have any questions, feel free to reach out to me. Thank you for your time.